Hey everyone, so now we'll be starting with part 2 of anesthesia. So, part 2 of anesthesia. Okay, so now we'll be talking about intubation. So, intubation will include several intubation blades that are used. Suppose we have Macintosh, then we have McCoy, then we have Miller's blade, then we have iMac video laryngoscope. So these are the four types of laryngoscopes that are used. So Macintosh, it is used in adults. So as the name says, it is Mac. So you can remember like burger is a curved thing. So it is curved. So curved blade is present. It is something like this. So it is something like this. Then we have McCoy, which is also Mac. So it means it is also curved, but this is a levered blade, which means you have some setting kind of thing to do. So we have a lever. So this is a levered blade. Now we have Miller's, and it is used in children. Then we have iMac, which has a screen like thing and we'll be seeing things clearly. So it is used for difficult intubation. It is used for difficult intubation. So these are the types of intubation blades. Now we'll be seeing about ET tube, endotracheal tube. So we have this is how an ET tube looks. So roughly. So now we have this connector. Then we have all these markings. So these are depth markings. Depth markings, and this is the tube basically. Then we have a radio opaque line here. We have a radio opaque line. Then we have a very important part, that is cuff, and finally we have a Murphy's eye. So Murphy's eye is also present. So this is used for delivering of oxygen, like in case of main tube is closed and there is no way for oxygen delivery, Murphy's eye will act as emergency part to deliver oxygen. So in order to check whether ET tube is inserted in a right position or not, we'll be doing chest x-ray, or we can also measure end tidal CO2. So end tidal CO2 should be between 35 to 45 mm per Hg. So if we have these two things, it means we inserted our ET tube in a right placement. So this is about ET tube and its parts. We have connector, depth markings, radio opaque line, then this is the tube part, cuff, and Murphy's eye. Now we'll be talking about sizes of the intubation blade and ET tubes and all. Coming to intubation blade sizes. So as we saw in LMA, sizes were like this, like male, female, children. So we went in a decreasing order, right? So this is how we went. Now here we just have to subtract by 1. So we'll be having male as 4, we'll be having female as 3, we'll have child 2, but in addition we'll be having term and preterm as well. So for preterm and term we'll be simply adding 1 and 0 like this. So these are the size of intubation blades. Now coming to procedure of intubation, which is a very important part. So intubation, while we are doing intubation, we'll be using our left hand, which will be inserted into the right side of mouth. So left hand and right mouth. So this is the combination that we use in intubation. Now pressure has to be low pressure. It has to be forwards and upwards. So this is low pressure. It is for ET tube basically, which we'll be talking later, so just forget about it for now. Instead we'll be focusing on this. So it is forwards and upwards. Insertion will be in this direction, pressure is applied in this direction, and most common injury will be upper central incisors. Then we can use burp maneuver whenever there is difficult intubation. Then we'll be doing backward, upward and right intubation. So this is used in case of difficult intubations. It's burp maneuver. So these points are very important. We'll be using left hand and right side of mouth, and forward and upwards is general pressure direction. Most common injury is upper central incisors. Then burp maneuver, where we'll be going backwards, upwards and right, and we'll be intubating. So this is used for difficult intubation. And coming to the next part, that is ET tube. So ET tube, so there's a formula here which says the resistance is inversely proportional to 1 by, it is proportional to 1 by r power by 4, or inversely proportional to the radius. So this is the relation between internal diameter and resistance. Now coming to the cuff that is used in ET tube, we always use a low pressure and high volume cuff. So this is used in order to avoid stenosis. However, in children, we'll be using micro cuff or no cuff. Like micro cuff is more preferred than uncuffed ET tube. So this is how we'll be using. Then coming to size of ET tube, sizes. So we'll be talking about a little peds thing here. So if baby's age is less than 28 weeks, it can be 29 to 34 weeks, then greater than 34 weeks as well. So these are different ages. Now we'll be talking about weight also. So if it is a premature baby, obviously it is less than 1.5 kg, then 1200 to 2200, then greater than 2200. So this is how the weight is. So this will be 1200 grams, of course. It's obviously not kgs. So now this is the weight of individual baby. Then sizes, it will be 2.5, 3 and 3.5. So you just have to remember this Heil box like this. So 28 weeks, 29 to 34 and greater than 34. Then we have weight, then we have sizes. So these are for different age groups and weight. Now for others, like child, female and male. For child it will be 3 to 4 again, and for female it is 7, and for male it is 8. So these are suddenly a very big scale range numbers, but we have to remember. Okay, so 7 and 8. Then coming to few formulas, so we have few important formulas here as well. So instrument, that we are going to have formula to calculate. So now instrument, in order to check ET tubes size, usually uncuffed, we'll be using this formula 4 plus h by 4. So this is the formula we'll be using. Coming to depth, ET tube depth, so to calculate this we'll be using 3 into ET tube. Then to calculate nasogastric tube or Foley's, so this is important again, we'll be doing 2 into ET tube. Then to calculate chest tube, we'll be doing 4 into ET tube. So this is how we'll be using formulas. This is also a very high yield table. So ET tube, if it is uncuffed, we'll be using this formula 4 plus h by 4. Then for depth, we'll be multiplying into 3. For NG tube or Foley's, just remember there are two things, so into 2. And chest, so usually chest is like 4 into ET tube. So this is the formulas we'll be using. Now coming to next part, we'll be talking about positions during surgery and which are actually related to anesthesia. So coming to next part, we have few positions like sniffing position. So first one is sniffing position, where patient will be like this. So his neck will be like this. We'll be having a single pillow here. So this is a single pillow that is present for support. Now if you see, check the angle, it will be something like this. So here what you can see is flexion of C-spine. Then we also have simultaneous extension of the atlanto-occipital joint. So this occipital joint is also extended simultaneously. But whereas in obese individuals whose neck is very short, we have another kind of maneuver, that is the ramp or help position, which means head and elevated laryngoscopy position. So we'll be trying to match tragus position with sternum. We'll be trying to maintain these things in a straight or same line. So we'll be having multiple piled towel layers. Then patient's head and neck is small, as we have discussed. So patient will be like this, almost like a straight position. Then we'll be having Selig maneuver. Then we have Larson's maneuver. So on Selig maneuver, we'll be holding patient's throat, we'll be holding patient's throat for few minutes. So this is used in emergency situations. It is used in order to prevent aspiration. Now Larson's is also another method that is used. It is basically holding, like if this is the face of patient, we have mask like this, so we'll be holding something like this, one finger here and one finger there near the angle of mandible. So this is to reduce laryngospasm. This will reduce laryngospasm. So these are the 4 positions that are commonly used in intubation. Now we have few tubes to discuss. So usually RAE tubes are used. RAE tubes, so they look something like this. So this is half the look. You'll be having a connector or port or something. So when patient, you usually have two openings. Like you can go like this or like this. So if you enter via upper opening, that is north, then you will enter into one field of surgery. If you enter in a south direction, you will be going into this opening, downward opening. So this downward opening, it is used for PNS surgery and cleft palate surgery, etc. Upward ones, like north direction one, will be used for lip or dental surgeries. So these are the two directions or field of surgery you can enter into. Now we will have some more devices that are actually helpful for intubation, like stillet. It looks like a rod. So this is how it looks. This is stillet. Then we have bougie, which is also used. So these things, they'll be giving support, like how you insert a rod in a wire and make it straight. So these things, they'll be used for difficult airway. And we have combi tube. So we have combi tube as well. Combi tube is better helpful for beginners. So in combi tube we have two lumens. One will be entering the esophagus and one will be entering the trachea. So it makes sure that oxygen is definitely supplied to the patient and there is no risk for the patient. Then we have flexometallic tube as well. So flexometallic tube is very flexible, as its name says. It is used in prone surgeries. So this is what you have to remember about this. Then we have double lumen ET tube. Double lumen ET tube. So double lumen ET tube will also have two lumens, but what is the difference here is it helps in single lung ventilation. Unlike flexometallic tube, it helps in single lung ventilation. So if you want to close one side of the lung or stop ventilation on one side, you can use this. So to confirm its position, we'll be using fiber optic bronchoscope. So this is how you will have various types of laryngoscopes, intubation tubes, and all. And these are the positions: sniffing, a base, Larsen, and Selick. And these are the sizes and formula and weights. So this is it about the second part. So it is a very important and high yield module. So see you in third module. Thank you.